'Cause something has changed in the way that I feel. Did you notice?
We love Pink Day because through the Pink Day, more people will be made aware of breast cancer.
This is one of the 10 central hospitals in the country. It was commissioned in 1972. It was a privilege for this hospital to be named after Charlotte Maxeke. She is one woman who ensured that everybody, especially women, are uplifted economically, socially, and any other way. The hospital is living up to that, not only for our patients, but for our staff, and to uplift our very brilliant clinicians who are willing to go an extra mile and empower themselves in terms of bringing new technology and research, and they shine.
We have a very dedicated team of people here that has worked with us for many years. Not only are we involved in the diagnosis and screening of breast cancer, but we also do a lot of teaching. We're responsible for the training of radiologists, medical doctors, as well as the radiographers who've chosen to do mammography as a subspecialty.
If we know more about the disease, we know more about the nature, the behavior of the disease, it will be much easier for us to know how to tackle it adequately. And that's what actually has pushed me to do the PhD, looking at breast cancer at a cellular level, so that we get to understand the disease even more.
It's better to get the cancer at an early stage, which is stage 1, because then it can be operated and be removed. It can be radiated through the radiation machines, or it can be treated through medication through medical oncology.
What tends to lead to more deaths is when the patient presents late. And from our research, we found that most of our patients they present late at stage 3 or stage 4. So what we're trying to do is to actually change the narrative, whereby we increase the awareness, because we believe with increased awareness, more patients will be aware of breast cancer, will be aware of the killer the breast cancer is, and as a result, they will present early at clinics or even hospitals. We know that yes, breast cancer is breast cancer, but you can have 2 patients with breast cancer, but how the breast cancer will behave, or how breast cancer will respond to treatment, will differ. And why will it differ? It is based on the molecular makeup, the genetic makeup of the breast cancer. That's why when we approach patients with breast cancer, we don't apply the rule of one size fits all. We individualize the patient's treatment.
So this breast care unit here at Charlotte Maxeke has been in existence for many years. I've headed the unit myself since 2002. We have a state-of-the-art 2D, 3D mammogram machine here that has all the technologies, tomosynthesis, contrast mammography, which are just other ways of imaging the breast to help us find early breast cancers.
There are 2 roles that the mammogram can do. One is to be able to detect the cancer before it actually can be palpable, and that is more important for those patients who don't even have any palpable lesions, what you call screening mammogram. And for those women who already have got lumps or have got symptoms, breast symptoms, there the mammogram will help to diagnose the cancer.
With the new machine came the ability for us to remodel the unit slightly. We did some drywalling and we changed up areas to increase privacy and to try and give the patient a better experience. We also got some nice murals added. We tried to add some color and some inspiration to the unit. It can be very stressful for patients coming through a hospital setting.
What is important is that after 40, every woman should at least try to do a mammogram once a year, because some of the cancers are so small that you can't palpate them. Therefore, it's important that you have this examination, but once a year you go for your mammogram. The best thing that ever happened was this partnership with Cricket SA, because through you, we have been able to prevent and ensure that many people, they know their status early and they are treated and they are back to their communities. Sports is a unifier. It has brought us together. The fact that Pink Day involves teams that are outside the country and it's spread throughout the world, it means the message that we would like to send as clinicians, as the health facilities, does not benefit only the people of Gauteng, nor the people of South Africa, because prevention is better than cure.
Our team has worked relentlessly through COVID, through a fire shutdown. They do their work happily with a smile, and we're there to offer the service to the patients. So come and visit us. They need to just make an appointment before seeing us.
This is do or die. Can you see the light?